Okie dokie. So here's some pathology support for Dr. Malhotra's findings and what he's been observing. Obviously, philosophically, if you can question it, it's science, and if you can't question it, it's propaganda. And as he alluded to, we've been experiencing much of that. Here in the United States, the FDA pushed these products forward as a vaccine without having done the appropriate gene-based authorization reviews and trials. So these were treated as a regular vaccine without biodistribution studies, without toxicology studies, without reproductive toxicity and fertility studies, without mutagenic studies, without dose dependency studies, and obviously without long-term studies. The shots were supposed to stay in the arm according to much of what we were told. Here you have a needle superimposed on a deltoid muscle, and here you can see a small venule within the fat lobules. And there you can see the post side effect of that needle shredding a venule. So these lipid nanoparticles with a gene sequence that are supposed to stay in one spot obviously enter a tube system that's under pressure. Now they can go everywhere. We do know from the biodistribution studies out of Japan that they went to the liver, to the brain, to the bone marrow, to the spleen, to the thymus where T cells are trained. Obviously, we went to the ovaries at a 12x concentration, and when they cut off the study at 48 hours, the curve was actually going upwards. We know that this gene that's injected with a lipid nanoparticle goes into cells of the body throughout all those places I mentioned and many more. They hijack the machinery of our cell and become a factory to produce a foreign protein and make our cells the factory for that protein, the spike protein, especially these mRNA-based platforms, and I will get to that in just a moment. These are investigational shots. They were labeled vaccines. Technically, they are a gene-based injection. We know that spike does not stay in the body. Early on, about a year ago, Ogata et al. From Harvard showed that the spike was circulating after the injection for at least a month. A more important study came out of Stanford by Dr. Roltgen, and in this study they showed that for at least 60 days the gene sequence as well as the spike was still present. And the gene sequence is still present because a pseudouridine was substituted. Normal mRNA breaks down in the body in 15 minutes, maybe an hour or two. But this synthetic sequence with tons of pseudouridine is persisting for up to 2 months. At that point, the study was stopped so they could go to publication. So we know it persists beyond that. Dr. Burkhart and some of the autopsy studies, I'll share a few of his slides as I just met with him in Vienna last week, showed that it was persisting 120 plus days later in the body. Bancel, Journal of Immunology, the spike protein was still circulating in the body 4 months in exosomes, 4 months post-injection. So it's interesting. This is a persistent protein compared to many other viruses that have been studied in the past. Sorry if there's the background noise. The elk are in my meadow in front of my house here, and it's mating season. So if you hear bugling, they are awfully loud at the moment. What does the spike do in the human body? Well, there are countless studies that show the spike protein causes tissue and organ damage. Obviously, as Dr. Malhotra alluded to, plenty of endothelial damage, the lining of blood vessels, clotting, cancer gene binding, P53 and BRCA gene, innate immune suppression. This is critically important and why we're seeing many other viruses waking up in shots of suppression. We're seeing autoimmune disease triggers due to very many similarities in the spike protein and other proteins in the human body, many analogs that overlap. The spike protein suppresses interferon production. Interferon is critical for fighting off infections as well as fighting off cancer. As I mentioned, the thymus is critical for training our T cells, especially when we're young, into our adolescence. So to suppress or have a lipid nanoparticle land in the thymus can adversely affect the ability to train our immune cells for a lifetime. We see viral reactivation due to suppression of toll-like receptors 7 and 8 in the body. We see DNA mismatch repair inhibition, again, a cancer mechanism. Neurologic damage, the spike hones to neurologic tissue. It does cross the blood-brain barrier. Lipid nanoparticles were designed to carry chemotherapy to the brain and cross the blood-brain barrier. We see mitochondrial damage, which is one of the causes of long-haul fatigue in many patients, in addition to viral reactivation of Epstein-Barr in about 50% of the patients from the colleagues that I have queried. We see cardiac damage. I will show that shortly. Immune imprinting, or narrowing of our immune response for future coronaviruses, because we only are seeing the spike protein over and over again. And when our cells make a spike protein, those cells now become a target of our own immune system. So that's antibody-dependent cellular cytotoxicity from a paper out of Dr. Hageman in the European Journal of Immunology. Out of Israel, we saw decreased sperm counts and motility for up to 6 months. Post-injections, we see countless women with menorrhagia and hormonal dysregulation, or prepubescent bleeding or postmenopausal bleeding due to the extreme hormonal alterations the spike protein can cause. This is the tip of the iceberg. Interestingly, many of these overlap mechanisms, many know that I was the first one to say, hey, we're seeing an uptick in certain types of cancer in certain age groups. And now we're seeing it even more and more everywhere I go in the world. This is being confirmed to me by radiologists, radiation oncologists, surgical oncologists, etc. And we're seeing more aggressive cancers very quickly in younger patients because that spike protein is triggering so many mechanisms. This list is almost identical to the lists of harms that I just mentioned, but I want to add one more thing. As the agencies review these products, there are fractionated RNAs, so incomplete sequences of the spike, smaller, shorter sequences, microRNAs, because the products are impure. These have been ramped up very quickly and put around the world in facilities that are not being inspected. Here in the United States, the FDA is not inspecting these manufacturing facilities. They're just trusting these manufacturers to do what they say they're doing. MicroRNA was shown by the European Medicines Agency, also by the TGA in Australia. What that means is 40 to 50% of the mRNA in some of these vials is shorter sequences that can code for other proteins. We know microRNAs can lead to cancer mechanisms. So when does the body stop making spike protein, especially from the mRNA products? Nobody knows. There's not a single study that has gone out in the longevity and proven when it actually turns off. With the adenoviral vectors, it's a different mechanism, so it would be expected to turn off sooner than the mRNA products. So here we see, this is what we do in the laboratory. We can use special stains. These are immunohistochemical markers. This is deltoid muscle. You would expect the muscle cells where the injection happened to be making spike protein. This is what we identify in those tissues. However, this lipid nanoparticle plus the mRNA, I've said in many a talk, is like a nuclear bomb because it can go anywhere. It's not controllable. We can't say, oh, you can only stop here. So like I mentioned, it can go anywhere. This new bivalent vaccine, interestingly, the Wuhan strain and the original shots, the Wuhan strain went extinct in humanity over 1.5 years ago. So that was a shot, number 1, number 2, shot number 3, the first booster, for a virus that was extinct a long time ago. So it's really interesting to be giving humanity a shot for an extinct variant of a virus. Well, now we have shots coming out for BA4 and BA5. Interestingly, we didn't technically study it on humans. There was a small series of Moderna tried in the UK on BA1 and the ancestral extinct strain. BA1 is now extinct as well. BA4 and BA5 in most countries is now on its way to extinction. All the mice that were trialed as the comparator group, instead of trying this on humans, all of the mice in that study, when sacrificed, still had COVID, BA4 and BA5. So now we still have agencies mandating a shot, which has high risks, which I'm going to get to in a moment here, beyond those ones I just showed you. We have a shot that didn't stop replication of the virus. If they're not safe, it is completely irrelevant whether or not they're effective, and they're not safe. Small vessel endotheliitis is absolutely a problem. We've seen aggregation of erythrocytes, bleeding, spike complexes forming strange amyloid-like proteins in the walls of vessels. lots of microthrombi, and obliteration of vessel walls. Plenty of papers in the literature, this one by Lee, showing the downregulation of ACE2 and the endothelial function downregulation, proteins degrading the junctional proteins that maintain the integrity of our vessel wall. This paper by Raghavan. These things are critical because this means if the vessel wall has no integrity, now the spike protein can get into the tissues through which those vessels course. Independent of viral infection, the spike protein will bind to certain receptors in our body. The CD147 receptor is abundant on platelets, on red cells, on endothelial cells, on pericytes that surround cardiac vessels. So that spike protein can be ferried into the cell and now begin its inflammatory cascades. From the Diagnostic and Interventional Cardiology Journal from Bristol, again, microvascular damage can be huge from the spike protein. Here's more of what we see under the microscope. This is a vessel, this little tube. All that brown is spike protein deposited in the wall. Now what that can do is cause those vessels to start producing cytokines in and of themselves and recruiting cytokine and inflammatory pathways. Then the vessels eventually get destroyed. Then the tissues can become infected by that spike protein post-vaccine. This can happen in any organ. Here we see in the spleen, damage to the vessel, and then these little slit-like spaces are cholesterol depositions. So we see, imagine a patient does have cholesterol in the walls of their vessels. The older a patient gets, the more they build up. And that cholesterol, because of inflammation, now becomes dislodged. So some of these blood smears you hear about in videos, or people see these, strange little floating things, and they call them, whatever they call them, microchips or whatever. They're not. They're cholesterol crystals that are being released because of inflammation and being dislodged from vessel walls. And here you can see it under polarization. We're also seeing amyloid deposition. Amyloid is an interesting type of protein that doesn't get broken down very easily, and this also weakens vessel walls and can block vessels. We usually see this in certain lymphoid conditions, but now we're seeing it interestingly induced by the S1 fragment of the spike protein, and Dr. Pretorius out of South Africa has done wonderful work on this, and I would commend her work to you if you want to become a thrombus nerd on how the spike protein causes amyloid formation and odd clot formation in the body. Here we see heart muscle. This is not normal. All those blue dots, this is myocarditis. This is inflammation infiltrating into the muscles, and you can see all that white space, that swelling within the heart tissue. And again, that's induced by one cell recruiting another, sending a signal, and then it's a big party of damage. Here we can see the early formation of an actual heart attack. Here we have acute inflammatory cells, and all that blue-gray material, these are extracellular neutrophilic traps. This is debris, these are cytokines, and it's gobbling away and destroying that cardiac tissue. And once those muscle cells are attacked, be it in an older individual or this myocarditis one hears about in younger children, many MRI studies and follow-up show that these children are forming scar. So it's highly important to understand that children receiving this shot, and a lot of the myocarditis is what we call silent. They have myocarditis that's not symptomatic, and they're forming scar, which is ominous for their heart health for a lifetime. This white area, that's what we see at autopsy, and that area of scarring is where the oxygen was cut off to the heart. On the left, you see normal heart muscle. On the right, you see lymphocytes invading the heart muscle induced by that spike protein. Interestingly, we're also seeing some amyloid deposited in some cardiac tissues between those muscle fibers. So it's not just inflammation, it's not just spike protein, but it's also this odd protein accumulating. Here we see on the left the spike protein. So people will ask, how do you know it's the shot? We know it's the shot because if you have a whole viral infection, you will also have nucleocapsid. So when we stain the tissue for nucleocapsid on the right, it's absent. that spike protein is produced by the cells that uptook the sequence. So spike produces in the endothelium, and then we start seeing destruction of the endothelium over on the right in these schematics. And so if you have an atheroma or a cholesterol buildup on the wall, now that can release that atheroma, and now you've got potential circulating cholesterol that can land and block vessels in other parts of the body, other parts of the vessels of the heart, the brain, etc. Here we see spike protein abundantly deposited around the wall of this vessel and in the myocardium itself, in the tissue of the heart. Here in just normal H&E studies, all that blue is coronary artery being massively inflamed post-injection. Here, same thing, you can see the vessel wall actually falling apart. All that white space in between is the vessel wall actually weakening and disintegrating due to all the inflammation. And here we see with special stains again, this is spike protein deposited in that coronary artery. We also see mast cells. So some patients, not all pathways of injury are the same in long COVID and or vaccine injury. We also see in many patients hyperallergic response, mast cell activation syndrome, all these little purple dots are these allergic cells degranulating, and this degranulation can lead to extreme swelling. That itchiness you feel after bug bites or after you eat a food you're allergic to, that's degranulation of eosinophils, degranulation of mast cells, and a massive release of histamine. So these factors can also play sway in the amount of swelling in cardiac tissues and other tissues of the body. Here we can see actually the fibroblasts within aortic wall are expressing spike protein. And then they can also induce, again, more inflammatory pathways, and that spike protein will recruit other cells and then start breaking apart the integrity of the vessel wall. And if your aorta ruptures, you are deceased very quickly. Again, more spike protein in vessel walls. You can see this onion skinning, and then all of that tissue around it is splenic tissue. It's the spleen. And interestingly, the spike loves to replicate in the spleen. All those brown dots are cells stuffed with spike protein production. Congo red, this stain we look for amyloid. So this interesting change in pinkish color is this thickened protein that's being deposited in the walls of many vessels, which changes the elasticity of these very important vessels in many organs in our body. Again, more spleen, just showing more spike protein. Well, importantly, we like our brain to work. Many of us have heard about brain fog post-COVID. Many people post-COVID, the spike can go to the brain there too in an infection. We're seeing higher quantities of spike being produced over longer periods of time post-injection. We know that spike protein can go to neural tissues. There are mouse studies that show that S1 crosses the blood-brain barrier. We know the lipid nanoparticle crosses the blood-brain barrier. Once that spike gets into these brain cells, neural cells, and it gets into all lines of neural cells, it destroys mitochondria in the brain, decreases the energy production in the brain. And the brain is one of our most metabolic organs in our body. All those brown dots are spike protein post-vaccine deposited in the brain. More spike protein in the brain. And this is necrotizing encephalitis. When there's enough there, enough inflammatory cells are acutely recruited, and now one has acute inflammatory cells actually destroying neural tissue. Same thing in the liver. The spike very quickly goes to the liver and within hours is replicating in the liver. And this, that blue is inflammation in the vessels of the liver. Kidney, this is very dense acute inflammation in the kidney. Again, vessels in all parts of the body, this odd protein can deposit. Skin, I've seen plenty of infarctions, cut off of circulation in the toes, in the fingers, and the distal extremities. It's because this spike protein goes anywhere and everywhere. All that brown on the right is spike protein in your tiny small capillary vessels. Again, tiny small capillary vessels in the brain as well. Again, we tested these against nucleocapsid. This is not an infection. This is from the shot. And I watched Dr. Malhotra's interview this morning, and he called for, and I agree with him 1,000%, we need to be doing a lot of autopsies. Governments around the world should be funding these. There's obvious harm clinically, observationally observed in all the reporting systems of the world, which are highly underreported. But we need to be honest scientifically and look, we in the pathology realms can show what did or didn't happen. And we're not here to cause a disease or prevent a disease, but we will honestly report what we do or don't see. And it's been really actually abhorrent that the world hasn't allowed pathologists or funded pathology around the world to do what needs to be done when we're learning from a new disease. This is how we've learned about disease for eons. Thankfully, this patient lived, but this is one of these thick clots that forms the spike protein in platelet-poor plasma. Again, Dr. Pretorius' studies. In the absence of platelets, the spike protein will aggregate circulating proteins in the blood and block vessels. These are post-mortem clots that I'm examining. Again, lots of amyloid-like material in these, lots of odd protein deposition, and these are anywhere from a few inches long to several feet long. That pink amorphous material, again, that's an amyloid-like protein. This is interesting. This is a uterine cast. So many people have heard of, obviously, the dysmenorrhea and atypical bleeding in women. Even in these casts in women, it's like an entire, if you're doing art or a plaster casting, the entire lining of the uterus comes out in one large cast, and a lot of that amorphous material. In clots, we normally see lots of fibrin, but lots of this is also that amyloid-like material induced by proteins clumping from the presence of spike protein, which, again, the gene-based shots makes our body make. This is unfortunate in terms of officials telling the truth. This is Deborah Birx, who was in the White House guiding policy, and in 2020 she said, this is one of the most highly effective vaccines we have in our infectious disease arsenal, and yet this year she came out and said, I knew these vaccines were not going to protect against infection, and I think we overplayed the vaccines. So from the power centers around the world, people that were in charge of controlling what would or wouldn't happen to humanity were very disingenuous and should have been truthful and honest in what was going to happen. They knew they weren't going to work. They knew they weren't going to stop infection. The shots don't prevent acquisition of the virus, transmission of the virus, getting the disease, or in many sad cases, dying from the disease. And unfortunately, those vaccinated don't form an important antibody in the sinuses called secretory IgA. That's why the vaccinated ended up being high carriers and transmitters of the virus. They ended up being the vectors of the virus. Those who had recovered from the infection actually had a far higher degree of protection. If we look at the study out of Qatar, 97% protection if you had COVID and had not had the shot. But we know from a New England Journal of Medicine study just a week or so ago that if you get a shot on top of having already had a COVID infection, you actually negatively impact your immune response and increase your risk of getting an additional infection. So you had a good broad natural infection, now you narrow it, and now you're at a higher risk for getting infected again. Basic immunology. Our director for Centers for Disease Control had to roll back so many things and finally admitted that they falsified information. On President's Day here in February, the CDC admitted they'd been withholding about 2 years of data from the American people. In August of this year, Walensky said that they need to overhaul the agency. Obviously, they failed in many aspects. And if you don't tell the people the truth, and they have our vaccine adverse reporting system here, which is highly underreported, but it is reported 86% by clinicians. And if you file a false report here in America, you can go to federal prison for a false report. So what is there is very medical and very accurate. It's just underreported. Historically, it's underreported by about 99%. My colleagues, Dr. Jessica Rose and Steve Kirsch, say it's between 10 to 41% or 10 to 41x. underreported. So we know there are thousands upon thousands of deaths post-injection. Those are confirmed, at least 14,000 just in the United States. In the OpenVer system reports from around the world, it's over 30,000 and millions of severe adverse events. But our own CDC admitted that they weren't following their adverse events reporting systems. They weren't even tracking harms. That is their one responsibility other than reporting disease outbreaks. Anthony Fauci said in 2018, natural infection is the mother of all vaccines. And when he was talking about the flu, it's interesting that we ignored natural immunity. With my background in virology and immunology, once one has had an infection, the immune system is an amazing thing. Why we ignored it around the world and punished people for that is beyond me scientifically. Here I just want to share some brief data points. This is cancer variants against trend. The world thought I was lying when I said I saw an increase in cancer. Now that I talk to doctors all around the world that are seeing it, I still say wake up, be willing to step forward and say what you're seeing. If you see something, say something. This is the variance cancer over trend from 2014 to 2022. You can see that inflection in mid-21 after the mandates rolled out, and we have a 14 sigma change in that trend for cancer right now. And I showed you the many mechanisms of harm of the spike protein down below. Also in our morbidity mortality report, we see that upward trend of excess death here in the United States, kicking in 21 compared to 7 years prior. And this is fascinating to me. Now, certain nations have already halted the shot. Denmark, no shots for anyone under 50. Most Scandinavian nations, no mRNA shots for anyone under 30. Uruguay stopped it for children. Other nations are very quickly recognizing the harms to their population, but what's really concerning is the excess deaths around the world now. And they're in Europe, in Iceland, where they took the shot extensively, a 56% increase in excess deaths in July. Other states, Spain, 36% over average on their excess deaths. And you can just read the numbers there. It's really impressive, but what you have to consider is the COVID rates are way down. Why are the death rates way up? And I think that's a very logical question to ask, and what's new in humanity that hasn't been here before. Integrity is the distance between our lips and our actions. I want to commend Dr. Malhotra for his integrity, for stepping forward and sharing what he's observing. It's courage, and courage begets courage, and I think our colleagues will continue to step forward now that important people like him have stepped forward, shared his experience. And again, I'm my heart feels for your loss, and I send you my warmest regards and deepest respect. I want to finish with one more thought. The opposite of love is not hate, it's indifference. The opposite of art is not ugliness, it's indifference. The opposite of faith is not heresy, it's indifference. And the opposite of life is not death, it's indifference. We cannot be indifferent in a world knowing what we know now.